Welcome back. Chucky's on 106.7 The Fan, live on CSN. It's become an annual tradition on the show, Vasectomy Madness. And once again, 106.7 The Fan's giving you the chance to win a free vasectomy. To enter, you go to thesportsjunkies.com and tell us why you deserve the procedure. We're going to be taking submissions until 10 a.m. on March 3rd, so you have a little over a week. You log on to thesportsjunkies.com, give us your story. It's all brought to you by the GW Medical Faculty Associates Urology Department. And joining us once again is Dr. Kelly Childs. She's a superstar in the urology world.
Yeah, she is. She's like LeBron James of the urologists.
She is. She's very good at what she does.
She's got magic fingers, Kate.
She does. I've seen her at work. Yes, I've seen her handiwork in person, up close and personal.
You know, somebody brought this. Let's just cut right to the chase. So somebody said, "Is AWOD eligible for vasectomy madness because he shouldn't be allowed to procreate?"
Right.
And I thought,
very good point.
You know what? I wonder, do you ever have an ethical dilemma as a doctor where you have a young person that comes in and you go, you know what? I'm just not going to do this. You're too young to make this decision. Even though you might be an adult, you're 21, 22, but you're like, you know what? I'm just not going to do this for you.
Sure. I think
Does that ever happen?
It hasn't happened to me yet because most of the guys that were really young, under the age of 22, 23, were married with several kids. So it makes it a little easier.
Right.
But
like, if you're a single
absolutely.
guy, and you're 21, you say, you know what? I just want to bang. I don't want to have children.
Yeah.
I mean, that's a little different vibe, right?
Especially when they're so set in their ways and they're adamant. You have to question whether or not in a few years, with a little more life experience, they're going to think differently.
Right.
And because you have to think of it as something that's permanent.
But we would be doing it for the greater good of society if we were to sterilize AWOD going forward.
I think
what
that
is
should
your
be something to
typical
consider.
patient?
My typical patient is married, and he does have kids. The average number of kids is between 2 and 3.
Really?
Yeah.
And is there an average age, or is it such a wide range now?
Late 30s.
Late 30s is the average. And then we were talking, I think we've talked about this before, but I remember we were giving Cakes a hard time because there was some study that came out that alleged that there was maybe some link between like early onset dementia and this procedure, and you say that's been completely disproven, right?
Yeah, so vasectomy is a juicy thing to look at because it's such a common procedure. It's the most common procedure that urologists perform in the U.S.
Right.
So it's when you can find a link between a common procedure like that and something as detrimental as dementia or prostate cancer, it gets a lot of billing, even if it's not true.
And it's completely bogus. There are no side effects of that nature, like a negative health consequence.
No. The only consequence of what we talked about, men who've had vasectomies are actually proven to have more sex after their vasectomy than men who haven't had.
Because they can just let it go.
That's right. Absolutely.
That's one way of putting it, Lurch.
How long does the procedure take?
It takes maybe 20 to 30 minutes. 30 is on the long side. 20 is probably on the low side.
Right.
And why would one take longer than the other?
Usually for me, it's, I'm a big proponent of making sure that he's comfortable. So I always ask, how are you feeling? And there's about a 5 to 10 minute window when we use the local, which is the same stuff that the dentist uses to numb you up.
That
when we
pretty
use
mild.
that to numb you up.
You sure that's strong enough?
Let's not worry about the patient. Let's worry about Cakes, who's looking at the guy's yam bag, who's uncomfortable. That's who's uncomfortable in the room.
We have different medicine
Have you
for
done
that.
the play-by-play every year?
Every
time. It's an annual tradition. Again, listeners, you can submit at thesportsjunkies.com, and then there's going to be a vote online to pick the winner. Because in the past, we've done it different ways, but it's an online poll. You have 250 words, I believe, to tell us why you should be selected for the vasectomy.